my name is Mackenzie and I'm going to be demonstrating how to give insulin today with an insulin pen and then also by drawing it up and mixing two types of insulin. Today is October 31st and it's approximately 9:30. Okay, I'm just going to go ahead and get started. So the first thing I'm going to do is give my wash my hands and put gloves on, and then I'm going to give my insulin pen first. Okay, so for the insulin pen, you're going to take the cap off, and you're going to clean the top with an alcohol wipe. Okay. Now, going to roll it 10 to 15 times. This is just to make sure we get the insulin all nice and mixed up. After I roll it, I'm going to open my needle and this on, and then you just screw on. Okay, and now that that's on, I'm gonna take this cap off and then prime with 2 units. Okay, and now according to my order, we're giving 5 units of Novolog, which is my pen. And before I did anything, I made sure to check my patient's blood sugar to see that they needed the insulin I'm administering, and the orders are fine with the blood sugar that he has. So since I primed my pen, I'm going to turn it to my 5 units that I'm administering. And before I administer, I'm gonna have a nurse check. So I have my 5 units here. And then now I am going to clean the area that I'm going to administer. I'm administering in the abdomen today. It's best for absorption of the insulin. Okay. So I'm gonna take my yellow cap off. I'm gonna pinch the skin, go in a 90-degree angle, hit the button. With the pen, you want to hold it in for an additional 5 to 10 seconds, just because it takes a little bit longer for all the insulin to get out of the pen. Okay, now that that's done, I'm going to safely recap my needle. Put this back on, unscrew, and then this will be disposed of in the sharps container. Put the lid back on and put it back where I found it. Okay, the next thing I'm gonna do is I'm gonna get my insulin ready for mixing. So I'm gonna clean the tops of both of these vials because they are multi-use. And before I put the air into my MPH, I'm going to roll it back and forth 10 to 15 times. Making sure not to touch the top. Okay, according to my order, I'm going to be administering 8 units of MPH, so I'm going to draw back 8 units of air and put that into my vial. Okay. And I'm going to draw back 4 units for my regular insulin. Put that into my vial, and then I'm going to go ahead and draw back my 4 units of regular insulin. And since we're mixing, I draw up the regular first. I can draw back a little bit more and push it up to my 4 units to make sure that I don't have any bubbles. So I have my 4 units. I have a nurse check it before I mix and take my syringe out. Now I am going to draw up my additional 8 units of my MPH, and that's going to give me a total of 12 units of insulin. And I'll draw up to the 12, no more than 12, because I can't push it back into the vial. That would contaminate the MPH. Okay, I'm going to recap my needle. I'm gonna clean my site and prepare to administer the insulin in my syringe. Okay, let that air dry, no fanning, no blowing on it. Okay, I'm ready to administer this. I'm gonna take the cap off, pinch the belly, administer my 12 units, and then safely recap and dispose of this in the sharps. And that's it.